Now we move to the state of Hawaii with the program Healthy Start, Loretta Funding, and Gail Breakier.
Aloha. The U.S. Advisory Board on Child Abuse and Neglect has declared child maltreatment as a national emergency. Child Protective Services and many other treatment-oriented programs are stretched to their maximum capacity, turning away families who are asking for help. Even though there wasn't violence in my home, it didn't mean that it wasn't coming. Everything was building up. I was ready to crack. Healthy Start was willing to stay and stick it through. The words of a parent illustrates one of the basic premises of Hawaii Healthy Start. Supportive families in their parenting role and the fostering of positive parent-child relationships will prevent child abuse and neglect. The Healthy Start Home Visitation Program provides services to families of newborn who have economic and social risk factors which place them at higher risk for child maltreatment. Parent education, problem-solving techniques, child health and developmental assessments are provided by trained professionals to 2,800 families annually. While the focus is on prevention, the program, which works with many families who mirror the profile of families known to Child Protective Services. With the assistance of Healthy Start, many families have moved on from lives of crisis, violence, and substance use to set goals, to complete their education, to become fully employed, and to become parent advocates. The U.S. Advisory Board called Healthy Start the STAR Home Visiting Program. It is Healthy Start's proactive approach, its focus on the entire family, emphasis on standards and staff training, and attention to outcomes which has contributed to its program's success. Further, the contracting of services with private agencies allows each program to be community responsive and culturally appropriate, while still addressing the protocols, quality measures, and outcome criteria established by the Department of Health. Comparison of child abuse rates have consistently shown higher rates of abuse among the non-served families and 3 times the rate of abuse among families served by less intensive interventions. A study completed by the National Committee to Prevent Child Abuse concluded that mothers who received home visitation program significantly reduced their potential for physical abuse. Healthy Start visited mothers displayed significantly greater involvement and sensitivity to their children's cues, and the visited children were more responsive to their mothers than the non-visited children. The Hawaii Department of Human Services has identified Healthy Start as its principal CPS diversionary program. To foster the further expansion of home visitation to at-risk families, DHS has approved an agreement to leverage the Department of Health dollars to capture federal dollars through Medicaid and Title IV-E. The prevention of child abuse, however, is only one measure of program success. Increased immunization and child health utilization rates have been documented among program children. Preliminary findings from a study being conducted by Johns Hopkins University has shown that when compared with non-visited mothers, Healthy Start families displayed a higher level of confidence in adult relationships, that their home environment was better organized and more attentive to their children, and visited moms were less distressed and more accepting of their children. These results reinforce a second premise of Healthy Start. That is, the creation of a more nurturing family environment will allow families to foster optimum child health growth and development. Recent research has confirmed conclusively that what happens to an infant in the first weeks and months of life affect the physical structure of the child's brain for their entire life. By the age of 3, a child who is neglected and abused bears the scars that are virtually impossible to erase and sets the stage for such long-term difficulties as severe emotional problems, school failure, and substance abuse. Healthy Start has been the inspiration for launching Healthy Families America, aimed at fulfilling the U.S. Advisory Board's recommendation to establish nationwide home visiting programs for new parents. Working with the National Committee, Hawaii has identified the core elements of Healthy Start and has provided technical assistance, which has been instrumental in establishing Healthy Start-like programs in more than 40 states. The lessons learned by Healthy Start, we feel, can assist other social programs to better meet the needs of children and families in their community. And we really like to thank you for this opportunity to share with all of you.
Thank you. Questions?
You've had a substantial cut in your budget. If the program's so good, what's stopping you from persuading your legislator and others to appropriate funds?
We've had a very difficult time the last few years in Hawaii economically. And other health and human service programs have been cut 90%, others have been cut 50%. We've held the line at 25 to 30% for Healthy Start. This has kind of spurred us on to really look at other ways to diversify funding for Healthy Start. We've been able to attract money from the Native Hawaiian community. We serve about 40% of the families we see are Native Hawaiian. And that's kind of spurred us on to look at leveraging our state dollars. The reality is there's just not enough money in the state. We keep plugging it and keep saying over and over again.
We have a lot of support from our legislature, and in fact, the president of the Senate is going to make early intervention his #1 policy package this year, and we're working with him. And we're hoping that between that and the federal maximization that I was speaking about, that we will, over the next few years, next 5 years, be able to make this program what we want it to be, that it would be able to reach every infant at risk in the state.
Dr. Rinings?
Yes, there are a number of, as you mentioned, programs in other states that even sound like this. One where in a state of Florida, where I used to live, same name. Would you kind of differentiate this, and is it the fact that there is such a concentration on child abuse and neglect as an integral part of this program? Am I right in that? Is that what makes this different from the other states' programs that have some similarities?
There's a little confusion because there's a national program through Maternal Child Health called Healthy Start, and that's to prevent infant mortality. Most of the programs that are replicated like Healthy Start are now called Healthy Families America, and the emphasis there is more on the prevention of child abuse. We feel that one of the strengths of the programs in Hawaii, though, is that we've integrated health as part of the human services spectrum, and that it really is an integration of health and human services, and it focuses on the entire family needs.
Max, you?
You acknowledged in the application that one of the obstacles was the limited availability of services for substance abuse, mental health, and domestic violence. Has there been any improvement in that with the economic situation? Could you tell us kind of where that is today? And I think the site visitor particularly identified substance abuse as a very critical element that needs more attention.
Right. I think what we're finding is as we are screening more families, that substance use is a lot more prevalent than it has been in the past. And because Child Protective Services have filled up their roles, we're getting more of these families. We're trying to work with the existing substance abuse programs to see if they could not give us more slots related to Healthy Start. The other thing that we're trying to do is give more training to the paraprofessionals so that they're better equipped to deal with some of these issues and direct the families to treatment services.
We have found that some of the paraprofessionals are very successful in helping the families to set goals that would include getting off drugs. And we have several examples of that where it's been very, very dramatic. But we do need more resources.
Dean Gordon.
Could you describe what you do to evaluate the program and what the results have been most recently? I know that for a certain time period there has been no child abuse reported, but how far back does that go and so forth?
We've been doing the comparison of child abuse rates for the last 7 years, and we've been following this cohort. So, and we expect to continue that. But we feel that's only one measure, and so we are looking at the health measures, immunization rates, health utilization rates, and for the parents, family planning utilization, and when moms become pregnant again, early prenatal care.
Which cohort is this?
We are looking at this as the entire system, or all of our families. We have a very extensive client tracking data system that we can look at all of. We have about 12 measures that we follow. But the more, if you want to say scientific, evaluation is the one that was conducted by the National Committee to Prevent Child Abuse, and the most recent one with Johns Hopkins University. And we are in our third year of a 5-year study. So at the completion of that study, we will have followed children for up to 3 years. And hopefully, with the success of that evaluation and the money